Thanks for joining us on another one of our live streams. Vitamin D, an incredible nutrient, a vital nutrient, technically a prohormone. It exhibits and exerts response and activity in areas of the body. So it's technically, you can term it, you can talk about it being a nutrient, but when it's converted in the body, it exerts what we call endocrine-like activity or hormone-like activity, technically speaking. We're not going to quibble about that. The vital role of vitamin D. Going back to 2004, I began to discuss the key impacts on our health from vitamin D and how vitamin D was grossly misunderstood, number one. Number two, the effects of vitamin D were very few, far and in between as far as our direct understanding. Thirdly, it was perceived to be a toxic nutrient if you used it in high doses. Now, did that turn out to be true? No. I don't want to get into the details of specific levels. If you go over 150 nanograms per milliliter, that's where you might see the toxicities. We want to talk about getting folks' vitamin D levels up into a reasonable range. Vitamin D. You convert it in your liver. First of all, you convert it in your skin. So if I'm exposed to sunlight, I convert it in my epidermal layers from cholesterol. It is then carried to the liver. The liver takes it through a conversion process. And also then the active form of vitamin D is finally then converted in the kidneys, in the renal system, the 125 version. What should you measure? What has to be measured from a laboratory standpoint is something called 25 OH, 25 hydroxy D is what should be measured in a laboratory scenario. The ranges, the typical ranges, the accepted range, depending upon the lab, 30 to 100 nanograms per milliliter. And we would tell you that the literature shows clearly that if we keep you out of this range, the sub 30 range, you're going to be a lot healthier. We don't need to have you. Literature doesn't support that you need to be over 100. Most of what we see is if we can keep you in that 50 to 60 nanogram per milliliter range, the most benefit is seen. So vitamin D, kind of a misunderstood nutrient. Folks think if they have their vitamin D levels analyzed and they're low, and that if they take vitamin D for a period of time and it comes up, then they don't need it anymore. Not so. You should have this redone, maybe annually, to see where your levels are and where they fall. What are the direct health benefits? Quite frankly, I can't even cover them in a time frame or an allotment of time that we're going to try to do this in 15, 16 minutes. There are links to everything from Alzheimer's to fibromyalgia, which we'll cover a little bit with, the immune system, type 1 diabetes, insulin resistance, insulin efficiency, insulin hookup, to autoimmune conditions such as MS. Is it a cure-all? Well, it's not a cure-all by any stretch. So I do not want to leave with you that you just do this vitamin D and you'll never get cancer, you will never have X, Y, or Z. That wouldn't be a fair assessment. What would be fair, though, after I just dropped those papers, what would be fair is to understand that vitamin D plays a very key role. And I'm going to have to grab these papers, so just bear with me for a second here. That vitamin D, thank you, that vitamin D helps to keep us healthy. If I maintain healthy, vibrant levels of D, I will maintain health for a greater period of time, clearly. So that 50 to 60 range is certainly our goal. It's where we want to be. And vitamin D, sun. We've done teachings, friend or foe. You need to have some sun. We don't need you to burn, but you need to have some sun. Where would you source it from? Would you get it from food? Well, you can get it from fatty fish. You'll get some in that area. Certain types of mushrooms and how they've been handled can exhibit a little more vitamin D. But you've either have got to have sunlight exposure to manufacture vitamin D in your skin and then convert it, or you've got to take it supplementally. So there's a lot of discussion today. Well, we don't need the D. The D is actually harmful. Well, I'm not real sure what folks are reading. I'm not real sure what they see, but I have documentation, black and white, from Cancer Research, American Cancer Research, American Clinical Journal of Nutrition, JAMA, non-Hodgkin's lymphoma, references, archives of internal medicine, all the way back to 2008, that show, for example, for cancers, all-cause cancers, if we keep you above roughly 35 nanograms, there's about a 38% reduction generally in cancers. It doesn't mean there's a reduction. Number two, we know that the specifics of breast cancer, that if we keep folks at 15 nanograms and above, there's about an 80% reduction of breast cancers that are seen. We know that ovarian cancer, if we keep you above 48 to 50, there's about a 17% reduction. So I can go through this. Type 1 diabetes. Literature shows that if we keep you above 50 nanograms, there's about a 65% reduction in type 1 diabetes. So whether it is with type 1 diabetes, is it a cure-all? No. Whether it's with type 2, we know that young children that have more adequate vitamin D levels have a lower likelihood or proclivity to develop type 1 diabetes, child onset. We know that they have lower rates of autoimmune conditions, asthmas, and certain types of skin conditions, dermatitises. We know specifically that inflammatory bowel diseases are directly associated to low vitamin D. Type 2 diabetes, insulin sensitivity. We know that if we raise an individual's vitamin D levels, we improve their insulin sensitivity. So whether it's with type 1 diabetes and reducing the potential onset, whether it is with type 2 diabetes as a 40, 50, 60-year-old, and we can manage your vitamin D levels and keep it in a healthier range, and I improve insulin sensitivity, which then reduces the potential for you to develop type 2 diabetes, we see tremendous information here. Let's look at fibromyalgia. What's the literature say on fibromyalgia? Is there a direct one-to-one correlation, specifically if you have adequate vitamin D, that you will not develop fibromyalgia? I wish it were that simplistic. Fibromyalgia is complex. Sometimes trauma, emotional trauma, physical trauma, exhaustion, physical exhaustion through years of just expending the body and pushing the body and burning the body out. Viral attack. Even some links looking now more at viral bacterial issues as being a trigger for fibromyalgia. Long-term duress, emotional duress. But what we do know is, in fibromyalgia, that if we can maintain more adequate levels of 25-OHD, there seems to be better response to whatever the treatments are, medically or integratively. There is less chronic pain that is seen when those vitamin D levels are functioning at a higher level. So we see a direct relationship with fibro, Alzheimer's disease. So I want to talk about two areas because we're going to run out of time, but Alzheimer's disease. Is it specifically same thing that you do not develop Alzheimer's if you have adequate vitamin D? No, what we do know is that vitamin D, there's a tremendous amount of vitamin D receptors in the brain. If I can manage and maintain healthier status with vitamin D, I can affect, ironically, there are many factors here, but with low vitamin D, you can impact the progression, the rate of progression, and so on by having adequate levels of vitamin D. Vitamin D is a facilitator of bone health, calcium absorption, how my body regulates calcium and phosphorus utilization, muscle function. Muscle function is critical. Cardiovascular system, highly dependent upon adequate levels of vitamin D. Your respiratory system, brain development in young children, also linked to adequate vitamin D. So vitamin D. So should I be out in the sun? Yes, you should be out in the sun. Should I get burned? Absolutely not. Should I be out there maybe for 30 minutes? Absolutely. I can develop 10, 15, 20, 30,000 and maybe more units of vitamin D depending upon your skin tone, color, African American, dark complexion. The darker the skin, the less the conversion. So you've got to be out in the sun. Do I need sunlight? I'm going to tell you yes. We see now that rates of MS farther away from the equator, that MS rates, multiple sclerosis rates, increase as you move farther away from equatorial regions. We see rates of even breast cancer higher in New England as opposed to Arizona, New Mexico, Utah, where there's a tremendous amount of sunlight, as opposed to New England, where there are many more dark days versus what we see in the Southwest. So whether it's breast cancer, whether it's fibromyalgia, vitamin D is not a cure-all. But if we look at conditions, we look at disease states, we look at type 1 diabetes, we look at multiple sclerosis, there are direct links to maintaining, from a young, healthy age, adequate and healthier vitamin D levels all the way through the course of your life. If you can maintain them, you have reductions. You have reductions in whether it's cancer, you have better pain management. Chronic pain syndromes are actually shown to have anywhere from a 35 to 40% reduction in the amount of pain medication that is used. Folks that are in chronic pain, either through trauma, car accidents, falls, where they are on strong, even opioids and narcotics for pain, that in many cases you can reduce anywhere from 30 to 40% the amount of meds by getting their 25 OHD levels into a good range. Fibromyalgia, chronic pain, MS. There's actually some centers around the country doing very high dose, bolus doses of vitamin D for folks with MS. Now, many of these studies are observational. So if you have a science background, you're going to say, well, okay, well, I know what that is. And that means you can't always draw conclusions. If you don't have a science background, I just told you what it, you don't do like a double blind, say, okay, you are 1-year-old, we're going to take 100 1-year-olds and deplete them of vitamin D for 20 years. And this other group, we're going to give vitamin D, and then we're going to look at diseases. Type 1, that would kind of be inhumane. So what you have to do is look at things observationally over the course of time. Look at individuals that have low vitamin D, no different than the study piece here that shows whether it's endometrial cancer, kidney cancer, MIs and heart attacks, falls, fractures, type 1 diabetes, non-Hodgkin's lymphoma. Basically, the chart shows that the more adequate your vitamin D levels are, there's a reduction in the incidence of those. Is it perfection? Is it 0 to 100? No. There's a general trend line. So I would say what we have to look at is observationally, folks that have healthier 25 OHD levels, supplementally or through sunlight, the general trend line is their physical health is usually better, whether it's chronic pain, autoimmune conditions, immune system. I could talk about this alone for 20 minutes. UCLA documented that vitamin D stimulates what's called antimicrobial peptides. By stimulating antimicrobial peptides, those are kind of precursors to the immune system. So you can utilize vitamin D technically as an immune stimulant in these cases. Folks in the wintertime, you should be doing tons of vitamin D, depending upon your level. 5,000 units would be nothing for me to do through the course of the winter. But also, it's an immunomodulator. So why would I call it a modulator? Well, because you can stimulate a weakened immune system against things like bacteria, viruses, and the like. Or in autoimmune conditions, if I have adequate vitamin D levels, I help to modulate or regulate the immune system. Vitamin D, critical nutrient, however you want to term it, prohormone, I'm just going to call it, for lack of a better word right now, a nutrient. Critical and vital to bodily function, whether it's inflammatory bowel diseases, Crohn's and colitis, whether you have a weakened immune system, whether you have Alzheimer's and dementia risk in the family. There's a lot of other factors, ApoE4, high homocysteine, high C-reactive protein, poor diet, high sugar intake. Those are all factors that enter into senility and dementia. But we know one common denominator is if we can maintain D status, we help to potentially reduce that risk. Vitamin D is a critical nutrient for human health. Unfortunate, there's been a lot of misinformation, misunderstanding, and not real direct speak about the value, the critical value, and the nature of vitamin D. Make sure you have your levels checked. A 25 OHD level. It can save you. It can help you. It can help to promote health, maintain your health. God bless you. Thanks for being with us and enjoying hopefully a little discussion on vitamin D and some of the benefits. And see you next time on our next live stream. See you then.